Now we're talking about extrapyramidal symptoms. Extrapyramidal symptoms of antipsychotic agents. So when we're talking about antipsychotic agents, you have to establish a background, find the diagnosis, determine the planning and implementation. And during the planning and implementation phase, you will come across side effects. Some of the side effects are tardive dyskinesia, neuroleptic malignant syndrome, and our focus right now is extrapyramidal symptoms. When you have extrapyramidal symptoms, you must observe for these symptoms and report them you must report them immediately and administer anti-Parkinsonian drugs that are as ordered. When you start to administer the anti-Parkinsonian agents to treat extrapyramidal symptoms, there are things that go along with them. Number one is indication. The indication to administer these drugs is to treat the Parkinsonian side effects of antipsychotic drugs, which is kind of funny because you're trying to give them antipsychotic drugs to get rid of their, psychosis, and yet you're giving them Parkinsonian symptoms. So anyways, if they're exhibiting these symptoms, give them antipsychotic treatment, and these are the you want to decrease the side effects. The action of the anti-Parkinsonian agents are to restore balance of acetylcholine and dopamine in the central nervous system. The imbalance is due to decreased dopamine and increased acetylcholine. So when administering anti-Parkinsonian agents to treat EPS, you will have common side effects. The most common side effects are anticholinergic side effects. That's acetylcholine. Anticholinergic effects are dry mouth, blurred vision, constipation, paralytic ileus, which it slows down their bowels. Constipated, that's why they're constipated, because their bowels slow down, they can't see. Their dry mouth, they get sedated, they get increased sedation. Urinary retention, they have dizziness, and when they're dizzy, they get nauseous, like they want to throw up, and of course that's upsetting their GI. They have increased tachycardia, increased heart rate, which is tachycardia. Their psychosis actually gets exacerbated, which is funny because they're trying to get rid of that. Orthostatic hypertension, their increase of temperature, so they have increase of temperature, but decrease in sweating. So they don't sweat, but they have increased temperature. Kind of weird. And these are the common side effects of anti-Parkinsonian agents. The contraindications or precautions, you don't want to give anti-Parkinsonian agents with a client who has hypersensitivity to these drugs. Also, if they have angle closure glaucoma, you don't want to give that to them. If they have lower GI issues such as pyloric, duodenal bladder obstructions, prostatic hypertrophy, or myasthenia gravis, which is muscle weakness, you don't want to give them all this stuff. Okay, contraindication. And those are the common side effects. So again, this was about the extrapyramidal symptoms that are a result of the side effects of the antipsychotic agents.